In my video, I took active range of motion for flexion and extension of the proximal interphalangeal joint. We started by sanitizing our hands, and then I introduced myself and explained that I'd be taking measurements to get a baseline for therapy. You'll notice that I'm going to begin by looking at the client's unaffected side. I positioned the client sitting up nice and tall with their upper extremities rested on the counter. I demonstrated the motion myself and then told the client to make a claw with your hand by bending at this knuckle. The client was within normal limits on her unaffected side, so we moved to the affected side. I palpated the dorsal aspect of the PIP joint and placed the axis here. The stable arm is on the dorsal part of the middle of the proximal phalanx, and the movable arm stays with the dorsal aspect of the midline of the middle phalanx. I corrected the client's compensatory motions to get an accurate measurement. I started by measuring the client's pinky in full extension and then measured the pinky in flexion. I also asked if the client was experiencing any pain. The norm for PIP flexion is 0 to 100 degrees, and for PIP extension is 100 degrees to 0. The client did not have any deficits.